Our next speaker is Brooke Rankmore, and Brooke is the CEO of Animal Management in Rural and Remote Indigenous Communities, also known as AMRRIC. And Brooke is proud to lead the organisation working with the board, staff, partners and communities to improve service delivery and education for companion animals. With a passion for rural and remote Australia, Brooke has lived and worked in the NT for 23 years, including 5 years living remotely on a cattle station and within a number of remote communities. Brooke has a Bachelor of Science with honours, a PhD and extensive experience in conservation and natural resources management in Northern Australia. Among other roles, she has held positions with Regional Development Australia, Greening Australia and City of Darwin, where she oversaw the Council's regulation of animal management through bylaws and responsible pet ownership education. Brooke is a current board member of the Australian Institute of Animal Management and the NT Animal Welfare Advisory Committee. Welcome, Brooke, to present Animal Management in Rural and Remote Indigenous Communities and One Health.
Hi, everyone. Firstly, I'd like to acknowledge the Yungan people, the custodians of the lands on which we meet. I'd also like to acknowledge the Larrakia people, the custodians of the Darwin region where the AMRRIC office is located. And I welcome all our First Nations people here today. I acknowledge their connection and care for country and pay my respects to those that led the way in the past, those that lead their people today, and those that will be leaders of their people in the future. So what I want to do today, I haven't given this presentation before, but what I wanted to do, I'm going to be talking tomorrow with Kay from Roper Golf about our programs on the ground, but what I wanted to do was talk about the philosophies that actually drive AMRRIC's programs and some of the sort of issues that we see. This was inspired by talking with Nell really about the conference and the theme of the conference, which is breaking down barriers. So I really wanted to talk about, and Jeremiah has given me a great intro, giving you an indication or introduction to Indigenous culture. And now I'm going to actually talk about a whole range of sort of these philosophies that AMRRIC uses to do our work in that context. So I'm going to talk about 3 different things that really are the philosophies that AMRRIC sort of operates under. I'm going to talk about society or social structures, so individualistic societies versus collective societies. I'm going to talk about ethnocentrism, so our personal biases that we actually have, and then I'm going to talk about One Health and the intrinsic links between people, animals and the environment, which is the philosophy that really drives how AMRRIC operates. So individualism or individualistic cultures is actually us, Western societies, an individualistic culture. We focus and emphasise on it boosts self-confidence, it promotes individual excellence, it enhances creativity, but it can also lead to a resistance to change, a lack of cooperation, and increased conflicts. The opposite of that in different societies is a collective or a collectivism society. So collective societies are often more traditional communities, and these societies really focus on we rather than I. So Aboriginal and Torres Strait Islander culture, as you've just heard from Jeremiah, is built around a collectivist kinship system, meaning that people think of themselves in terms of their affiliation with others, with their community, and even with their country or their environment that they're from. Whereas when we talk about ourselves, if you were to ask me my background, I'll start telling you about what I've done, where I come from, etc., but not necessarily in the context of how I fit into that. It's about me rather than we. And this is just the society, this is just, the differences that we have. What I want to do now, though, is actually just show you, and I don't know if any of you did participate, but late last year, or early, no, it might have been earlier this year, the federal government was going around talking to different charities and not-for-profits about the blueprint that they want to do for the charity sector and not-for-profit sector. And I attended the one in Darwin, and I found some quite interesting stuff here, and I just want to sort of go through it because I think it talks about, it shows that actually as a society we're becoming more individualistic. And so this is just some results to show you, but this is a survey that was undertaken in 1984, which is the dark line, 2005, and then the lightest colour is 2018. And it was really just asking people about how many people are that close to them for different things. So the first question is, among your family and friends, how many people are there easily available whom you would talk with frankly without having to watch what you say? And as you can see, for each of those, over time, our group of people that we trust and confide in has reduced. If we think about social media, how those things are playing into it, you know, I'm a mother of 2 young kids and I am just freaking out about how much my kids want to spend on electronics, and every single other parent I know is the same. Rather than being out socialising, we are becoming more insular. We're moving to social media. And so, as you can see from the survey, we're moving away from being collective. We're moving away from collaboration. We're becoming a lot more individual. Some of the information I found is that actually individualism has increased roughly by 12% worldwide since 1960, and the majority of our larger populations are actually in collective communities. So that sort of gives you an indication. As I said, individualistic cultures leads to smaller social support networks, lower emotional competency, low interactions to seek help, and often poor mental health, which of course, you know, we're seeing higher and higher rates of mental health. So when we think about the fact that we're actually isolating ourselves a lot more as a society. Next, philosophy that I want to talk about is ethnocentrism. So ethnocentrism is the judgment of other cultures according to preconceptions of superiority originating from the standards and the customs of one's own culture. So basically the fact that we think that our culture is correct, because that's what we've grown up with, that's what we know, and it's right. To give you like a really simplified example, if you refuse to bow when greeting a Japanese friend, insisting on shaking hands, you display your ethnocentrism. We've got American friends here in the room. They drive on the opposite side of the road to us, you know. I think we could commonly say they drive on the wrong side of the road. I'm displaying my ethnocentrism here, that we are right and you're wrong. So it's one of the things, and it's very hard to actually break. And it's something that takes a lot of self-reflection to really work out what your personal biases are and to be completely open to things that are outside of our comfort zone. So this is something that does definitely push us into an uncomfortable place. And even the most non-judgmental people can succumb to culture shock and subsequent ethnocentrism when subject to cultures that are significantly different from ours. And we see it with our interaction with Aboriginal and Torres Strait Islander people, because as a collective culture, it is definitely where I can see the headbutting of and the lack of understanding and awareness, because the thinking is so different from what we are used to. So the third one I actually want to talk about is health. So quite often when we think about health, we think of the historical definition of health, which is the absence of disease or injury. And so by this definition, if we are not sick or injured, that means we must be healthy, right? But we know that it's not that simple. Thinking more critically, people can have a disease without feeling sick, and people can feel sick without having a disease. And when you really start to think about it, the absence of disease is not health. So looking at health in the absence of disease or injury also fails to acknowledge the importance of our social and emotional well-being and our overall health. In response to the limitations of the traditional health definitions, the Constitution of the World Health Organization has acknowledged that health is more than an absence of disease or infirmary, instead defining health as a state of complete physical, mental, and social well-being. It also acknowledges the highest attainable standard of health is a fundamental right for every human being. But for Aboriginal and Torres Strait Islander, when we look at Aboriginal and Torres Strait Islander health, moves even further beyond the physical well-being of an individual, recognising connections to land, sea, culture, family, and community. So health programs for Aboriginal and Torres Strait Islander people are often more holistic and include the physical, social, emotional, cultural, and spiritual well-being of both individuals and communities across that life course. Aboriginal and Torres Strait Islander healthcare services strive to ensure that everyone can achieve his or her full potential as a human being and bring about total wellbeing in their communities. And this is some of the work that AMRRIC tries to feed into. And there's also a common Aboriginal and Torres Strait Islander phrase that says, if you look after country, the country will look after you, which emphasises the fact that caring for country can have a profound effect on the lives of Aboriginal and Torres Strait Islander people, acknowledging their reciprocal relationships between people and the natural world. So while health itself is dynamic, there's also a number of factors that contribute to the health of people and communities, including the social and cultural determinants of health, which I'm not talking about today, but we will talk about tomorrow, just to give you the context of the social determinants that are impacting the health and wellbeing of Indigenous communities within this country. So social determinants of health can have important influences on health inequalities or inequities, and will in some cases have greater influence on human health than healthcare or lifestyle choices. So again, if we look beyond human health as an isolated entity, One Health is the holistic, multi-sectoral view of health and recognises the interconnectedness between the health and wellbeing of people, animals, ecosystems, and their shared environment. So as an ecologist, in my training, this makes complete sense to me, because in ecology, I may be studying a particular species to look at the impact of land clearing and agricultural design, but I need to understand how fire has impacted them. I need to understand what their habitat requirements are. I need to understand the complexities of the landscape to work out what are the important features that are driving this species and driving their decline. So One Health, to me, and that interconnected makes sense. And we really need to be looking at a much bigger picture. Even if we're only targeting one aspect or one element, we need to understand what the flow-on effects of that are. And if there's not other people working in that space, then how do we impact that? So One Health is all about recognising that people are connected to our world and that other plant and animal species. This means that working to improve the health of one can have beneficial effects on the other. So AMRRIC's work is focused on improving the health and welfare of companion animals in order to improve the health and well-being of the broader community and their shared environment. So when I'm talking about AMRRIC as an organisation, I'm talking about the fact that we're a health organisation, not an animal welfare organisation. We just are looking to improve the health and well-being of our community by improving the health and well-being of the companion animals that they reside with. So if we look at One Health issues, there's a whole range. One Health approaches are rapidly gaining recognition and as an important and effective means of managing, the issues in a human impacted environment. what I'm going to do is speed through because that's come around real quick. So what I wanted to do is just actually show you clearly like a whole range of different aspects that go into health. And then, of course, when we're talking about a collective society, you've got this, and Indigenous communities, we've got social determinants and cultural determinants. And suddenly, when you actually start looking at the interactions between all of those, it can get very messy. So really, it's just about having to think more broadly and try and understand what all the flow-on effects are. If you drop a rock in like a pebble in the pond, it's not just that location that is impacted, it's the entire surface of the pond, and you get those ripple effects, and it's about understanding what those are. So some of the key messages out of those sort of philosophies from our point of view is we need to break down the silos. And I mean, we see it all the time. We see it in government. It's an individualistic society thing that we do. We don't work well together. That's just the reality. And we struggle to work out who needs to be at the table. But breaking down the silos, ensuring you've got everyone at the table and ensuring you've got the right people at the table. Knowing our biases, so needing to self-reflect and identify our own biases and being aware of them. And that's very hard to do in our society, to actually take the time to self-reflect and understand what our biases are. And looking at the bigger picture, understanding your role that you play in that and what the flow-on effects of that are. So for those of you who don't know, and I'll talk about us a bit more tomorrow, but AMRRIC, Animal Management in Rural and Remote Indigenous Communities, is a not-for-profit organisation that coordinates culturally safe veterinarian education programs in rural and remote Indigenous, Aboriginal and Torres Strait Islander communities. We became formally incorporated in 2003, so we're 20 years old this year, but we haven't had time to celebrate, to be honest. It's just been too busy. We're founded by a handful of dedicated veterinary and environmental health advocates who had a vision for a coordinated and holistic approach to companion animal management in remote communities. AMRRIC exists to assist and empower communities to meet their needs for companion animal health, care and safety. AMRRIC's board, an Aboriginal and Torres Strait Islander advisory committee, of which Jeremiah is a member, work together to guide and govern AMRRIC, and we are a small team of staff that work closely with our many partners and on the ground, and we've got a number of councils and other partners that we work with in the room here today. So what I really wanted to do was quickly just talk through some of AMRRIC's approaches, thank you, and how we've taken those philosophies that I've just talked about and how we're implementing them and how we live by them in our programs. So AMRRIC keys to our approach is understanding and respecting people's connection with their animals, working with all stakeholders to co-design and implement culturally appropriate tailored programs that meet the needs of community as a whole. So while our programs are fundamentally the same, every program is different, and you saw from Jeremiah's presentation the diversity of cultures and languages that we have, and so that creates quite a lot of challenges when you're working at a national level with a number of communities. So everyone is different and individualistic. And of course, we work very hard to build trust, valuing relationships and advocating for best practice and experience and authenticity. So when we're delivering our programs, it's only via invitation. We do not go where we are not asked to go, even if there's need and we see it. Unless we're invited, unless people on the ground are interested and this is something they want, we're not there. We always ensure that the impacted community are part of the table, and those that are authorised or responsible stakeholders are included. And if neither of those parties are there, then we don't go in. We deliver our outreach through door-to-door engagement so that we can have one-on-one conversations with everyone and have true engagement. That door-to-door engagement is always undertaken with local liaisons, so someone from that community that speaks language, who is known, who has trusted relationships. We never work alone. Can you imagine, a lot of these communities, Aboriginal people are constantly got white fellows coming out, asking questions, doing surveys, wanting information. They're constantly humbugged, to be honest. And so we're always doing it in a lot less intrusive way. Yep, thank you. We also do no survey without service, so we always provide some level of service. If we're going door to door, we're providing antiparasitic medications as we do that for all the animals. And we also operate under a herd versus an individual welfare approach. The thing I want to talk about with outreach programs is I just wanted to show, and I think that a lot of the outreach programs that we see don't necessarily address the real core priority. I think more and more, I've been in this sector now for almost 10 years, and I'm definitely seeing more and more people starting to attack the area of multiple barriers. But basically the people that are in the green, no barriers, are us. We can decide which vet we want to use, what services we wish to provide, and we can purchase those. The orange band is often, have a limited, they may have a financial barrier, but they would still like to get their animal desexed, or they would like some assistance. So that's the orange band. The people in the blue band, that's where our animal welfare issues are, that's where a lot of councils' issues are, and those people have so much chaos and dysfunction in their worlds, domestic violence, drug abuse, whole range of stuff, that they're not even thinking about veterinary services, and that's where we need to be putting in a lot more of our effort. So I just quickly want to talk about misconceptions. A lot of things that we see and a lot of people coming into the Aboriginal communities is that people think that free-roaming dogs are strays. They are not. Jeremiah touched on it, they are family, and it's actually more of a companionship relationship, whereas ours is an ownership relationship. So with Aboriginal people, that animal is there because it chooses to be there. If it wants to go down to Auntie Betty's, it'll choose to go down. It has free will. It is its own individual and it has free will, and it decides where it wants to be, but it is owned. And so if you go in there and actually start trying to rehome these animals thinking that they're unowned, you're probably stealing someone's pet, in all honesty. Animals in poor health are unloved and uncared for. It's definitely not correct. Well, just as there is in Western society, in Indigenous society, there are true animal welfare issues, but the majority of what we see is actually a lack of access to services and availability. I just want everyone to really think about considering the bigger picture and investing in the cause rather than the symptom, and actually look at things as a population rather than an individual approach, because we can achieve a lot more at that level. Ensure you've got the right people at the table. Be really careful about our social media, the amount of hurtful stuff that I see on social media. As organisations, we need to be accountable and ensure that we are not causing more harm, and we need to be aware of our ethnocentric preconceived notions and those of the people who are following us, who may not be as educated as we are. And you need to ask yourself while you're there, why you're there. And often, if it's that you're wanting to seek gratification or self-gratification, then you might need to question yourself. Often what you need to do is by leading as leaders, we lead from behind and elevate those partners and those people that we support together. I think that's it. Yep. Thanks.